Let's talk about creatine for women in perimenopause and menopause. This right here, whether you use this brand or any other brand, I'm going to tell you why it's so beneficial. Just so you know, creatine, I'm looking at my notes. It's a naturally occurring compound found in small amounts of certain foods like red meat and fish, okay? And produced by the liver, kidneys, and pancreas. It helps supply energy to muscles, the brain, and it's stored primarily in the muscle tissue as phosphocreatine. So, why is creatine beneficial for women in perimenopause and menopause? These are things that you either want to talk to me privately if I am your practitioner, or you want to get with your holistic, naturopathic, functional medicine practitioner or your medical provider to go over this if you would like, just to make sure that your kidneys and liver are both appropriate for you to use creatine, and especially your heart. So why is creatine beneficial for women in perimenopause and menopause? So during menopause, that transition, women may experience muscle loss, which is sarcopenia. It decreased energy. Yeah, how many of us been really hard to get off the couch? Brain fog, forgot where you put your keys, forgot where you put even like the simplest things, okay? Also, mood fluctuations. Have we already checked your hormones? What else is going on? Increased fatigue. I'm talking, okay? We've already checked your iron. Iron looks good, but what's happening here? Do we need to add some creatine? What about hormonal changes affecting bone density and strength? All right, going to scoot this over for just a quick bit. So creatine can help address many of those challenges. It can preserve lean muscle mass. How many of you are on a GLP-1 that's synthetic? Okay. If you're on a natural GLP-1, especially the one that I talk about, we're not going to be having that problem at all. It preserves lean muscle mass. It supports strength and muscle maintenance, which declines with age and reduced estrogen. All right, so it improves cognition, function. It supports that ATP, adenosine triphosphate production in the brain. It's helpful for reducing brain fog and enhancing focus. All right, so reduces fatigue, especially important for women who struggle with energy that dips, especially related to those hormone shifts. I'm 46. I'm absolutely noticing that. If you noticed it before 46, I totally understand. If you noticed it after 46, I got you. Let's give these a try. Aids in recovery and cramping. Creatine may help improve muscle recovery post-exercise and reduce the severity of menstrual cramps by improving muscle hydration and function. Did I not just blow some of your minds with this research? All right, this is the other super fun part that everybody in the house is going to love. It enhances mood. Some research suggests creatine may support mental health by improving brain energy metabolism. If you find yourself speaking with a mental health practitioner, if you find yourself speaking to your life coach, if you find yourself speaking to your licensed practicing counselor, let's see. Okay. All right. So this is the dosing guidelines, and this may vary. Okay. Results may vary, all those things. Make sure you speak to your practitioner first before diving right in, because they may be able to find you a good naturopathic creatine that is going to be fantastic and perfect for you. Okay. Dosing 3 to 5 grams daily. Okay, so why? It may reduce cramping, bloating. It does support energy and recovery during a time when many women would actually feel depleted. Okay, here's a tip. Stay hydrated. Okay, stay hydrated, because creatine, it actually pulls the water into the muscle. Perimenopause. This is that dosing about 3 to 5 grams every single day. Why? Because estrogen fluctuations, it can cause inflammation and fatigue. Creatine helps buffer these effects and supports brain and muscle health. Emotional loading phase that some women can benefit from, like a 5-day loading phase where they have 20 grams a day and that's split into 4 doses. But it's actually not required. But if you feel like you need to just kind of go in and give yourself these good loading doses, make sure you're talking to your provider first. Make sure you don't have any heart issues or kidney or liver issues, or to make sure your metabolism is still rolling and going. Okay. Menopause, post-menopause. The dosing is 3 to 5 grams. So if we're thinking that we've already said this twice now, it looks like it's consistent. So, okay, look at that. So 3 to 5 grams daily. Why? Because it helps combat age-related muscle loss, supports cognitive clarity, and maintains strength and balance. Okay. I've seen many people falling and doing different things like that. So let's go ahead and give a chatter to our practitioners to see if this is something we can try. When is the best time to do this for menopause, post-menopause, post-workout, or with a meal for better absorption? I never, ever talk to my clients and say to take this capsule on an empty stomach. I think 99.999 times it is going to be take that with food, and especially something with like at least 200 calories, and it's got to have some protein in it. Okay. All right. So what types of creatine is best? Looking on the back here, this one says creatine monohydrate. So let's see how this one compares. This one is creatine monohydrate gummies, and it also says that this is 3 gummies. Okay, so creatine monohydrate is the most researched, cost-effective, and safe form. Okay, look for micronized creatine monohydrate for better mixability and absorption. Complementary natural supplements for hormone support and recovery. We're just going to add this little bit in here as just an extra support for you. Okay, this is extra. This is bonus material. Yay. All right. Because this is complementary natural supplements for hormone support and recovery. Okay, we're still getting up, we're still active, we're still doing our thing. Okay, magnesium glycinate or magnesium malate. Those ease cramps, those support sleep, those reduce anxiety, and enhances creatine uptake. Omega-3 fatty acids, fish oils. Reduces inflammation and supports joint and brain health. Ashwagandha. It's an adaptogen that helps balance the cortisol, like in your kidneys, and may support mood and energy. What about rhodiola rosea? I have that somewhere here. There it is. All right. It supports mental clarity, focus, and fatigue resistance. So we've got B-complex vitamins. Those aid in energy production and hormone metabolism. What about D3 and K2? Those must be combined. Okay, unless you have a bleeding issue, then the K2 out the door. That's essential for bone health, especially post-menopause. Collagen with vitamin C supports joints, skin, and connective tissue health, especially helpful when combined with creatine and resistance training. Safety notes for creatine use. Hydration is key. Creatine increases water retention in muscle cells. Drink enough fluids. No loading needed. Steady use of 3 to 5 grams a day is effective over time. Kidney health. Generally safe for healthy individuals. Women with existing kidney issues should consult with their provider. Cycle creatine, not necessary, but some prefer 8 to 12 weeks on, 4 weeks off for peace of mind. All right, if y'all need any more information, you want some more details, let's talk.